Good morning, students. I am excited that you guys are back at school, and hopefully it's Thursday. I really do hope it's Thursday, but if it's Friday, then that's okay too. I will be making a video for hopefully Thursday and Friday. So if this is your first day back at school, this should be the video that you are watching. I hope everybody had a great winter break. That was kind of unexpected. I mean, I was excited for the first Monday, Tuesday, Wednesday, Thursday. By Friday, I was like, okay, I got to get out of my house. So how about you guys? Did y'all go stir crazy? I sent out an assignment, an extra credit assignment, and people started sending it to me in like 2 minutes. So I thought, wow, you guys must be really bored. But anyway, I hope you did enjoy your winter break, got to eat some good food, spend time with family and friends and all that stuff. All right, so we have literally been out of school for 2 weeks, and it was really at the most important time in our curriculum, which is going to be vital signs and then basic life support, or CPR, for healthcare providers. So with that said, I'm not going to rush through these 2 sections. We're still going to take as much time as we would have if we were, if we had never, stopped coming. I do want to tell you that your test, your medical abbreviation test that was assigned, right after we came back for Christmas, we were supposed to have that yesterday. Obviously, we're not in school. So I'm going to move that till the 30th. So that gives you to next Tuesday. It's just, I think we've gone through M. I have not made a Quizlet, but you are welcome to make a Quizlet on your own. If I have time, I will do that. But those are the abbreviations that you need to know. Also, I will not be there today or tomorrow, so Thursday or Friday. This was a pre-planned trip that I'm going to the Alzheimer's Association Summit. It's a yearly thing that they do for their volunteers that they invite, which I'm on a committee for this area, so I was invited to this summit in New Orleans. So this is another great thing about being a healthcare provider, but then also just being involved in your community and doing the work to help your community. It's a volunteer position that I hold with them, but they're paying for this trip. So that's really exciting because, most of the time our volunteer hours, they're always to help other people, but every once in a while you'll get to go on a little trip or something and get some training, which is what I'll be getting while I'm gone, about better how to involve our community, just how to get more community involvement in the Alzheimer's Walk. So more about that later. All right, so we had talked about pulse in all classes. So if you are B shift and you're watching this, y'all are on respirations, and so that would be something that you would want to go to the next slide, okay? Go to the next little section. All right, so just as review, what is the normal range for pulse in adults? 60 to 100. I hope you said it out loud. All right, everybody, it's 60 to 100. So what are some factors that influence pulse rate, bringing it up or down? So, of course, exercise would make it higher, but pain and fever is going to make it higher. Also, heart disorders. Then low could be rest or sleeping. Could also be heart disorders, or someone that just has a well-trained heart that, like an athlete, may have a lower resting heart rate. The definition of bradycardia is a slow heart rate. That means less than 60. And the definition of tachycardia is a fast heart rate, over 100. All right, so moving on to respiration. So respiration is the process of taking in an O2 and expelling CO2 from the lungs. Breathing, okay? So when we're talking about counting someone's respirations, we're counting how many breaths that they are taking a minute. So one respiration is one breath in, and 1 breath out. So that's 1. So in a minute, when we start counting these, sometimes students, the same way as they count the lub-dub, like lub-dub, 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 and count that as 4 heartbeats or 6 heartbeats when it's really 3. It's the same thing with respiration. So when you see chest rise and fall, that's 1, okay? So that's how we will count your patient's respirations here in just a few minutes. All right, so the normal adult rate for respiration is 12 to 24 breaths per minute. So again, if you're in B shift, you need to go ahead and fast forward through this and get to, I think, blood pressure's next. So go on and fast forward through that. So this is our normal. Now, if somebody's respirations, if they're passed out asleep and their respirations are 10, I'm not, going to necessarily raise the alarm. But if they're 8, and they've been on a morphine drip or something like that, then, we probably need to wake them up and not give them any more morphine, because that is something that knocks out respirations. Actually, that is what kills people in overdose situations, is that their respirations get knocked out. If it is greater than 24, let's say their respirations are 26, and maybe they just ran from the store back over to the classroom. Again, not something I'm extremely concerned about, but if a patient comes in and they are just huffing and puffing 30 times a minute, and they've had a cold and they say they feel like they can't breathe, then I'm concerned. Okay, this is a patient that could benefit from some supplemental oxygen, especially if their oxygen is already low when we check it with the monitor. So it just depends on the whole situation, okay, as to whether or not this is a concern or not. All right, so what are some things that you think can cause increased respirations? Well, exercise, absolutely. We know when we run or anything like that, we're going to have increased respirations because our muscles are saying, hey, we need more oxygen to do what we're doing, and so that triggers your brain to breathe more. Stress and anxiety is also another cause for increased respirations. Can be very difficult sometimes if somebody's very stressed out or if they're having an anxiety attack to control their respirations. And then respiratory distress, like the patient that I just described to you that maybe comes in and says they can't breathe. So their brain, the same way as an exercise, their brain senses that their oxygen is low, and so they're breathing more to try to bring in more oxygen. So a patient that is in respiratory distress, you really can't sit on, okay? That's a patient, like if I come in with a broken ankle, as painful as that is, but then someone else comes in with respiratory distress to the emergency room, respiratory distress goes back first. What are some things that cause decreased respirations? Sleep or relaxation is the main one. When you're just sitting around, you're not going to be taking as many respirations as when you're up and moving or talking or all those things. And then respiratory depression. So respiratory depression would be if in the case of drugs, especially with opioid drugs, if someone has overdosed, that is what normally causes their death, is the respiratory depression. So that is why Narcan is saves lives, because it reverses. And so they'll start back breathing again. But respiratory depression also exists, like for, let's say, the patient that comes in respiratory distress, breathing 30, now they're up to 36 times a minute. We've got them on oxygen. We're trying to figure out what's wrong with them. So that's the thing about respiratory stuff. Like, okay, I know their oxygen saturation is 92, which is not good because it should be 95 to 100. I know they're breathing 40 times a minute, but what is the cause here? And so if we don't find out the cause pretty quickly, you can only breathe 40, 50 times a minute for so long before then the respiratory system just gives out, and that's where you get respiratory depression. All right, so some important respiratory vocabulary. is dyspnea. So dys means difficult, and PNEA always has to do with breathing. So dyspnea is difficult or labored breathing. Apnea is the absence of respirations, and yes, this is like sleep apnea. If your parent or grandparent has sleep apnea and sleeps with a mask, it is because they stop breathing during the night, and then their brain will wake them up, and they'll usually make this really loud snorty sound when their brain has triggered them to wake up. Sleep apnea has a lot of consequences. Untreated sleep apnea, and there's so many people that they just don't want to wear that mask. Well, they really don't know that they're not sleeping. They really don't know how terrible they feel until they start wearing it, and then they realize, oh my gosh, I didn't know how bad I felt before. But a lot of people just do not want to wear that mask. They do not want to do anything about it for whatever reason. And it causes high blood pressure. It can be an underlying cause of stroke, lots of things. And we're finding out things all the time. Definitely obesity. Not sleeping well is one of the biggest reasons of obesity. So sometimes if patients will just take care of this one little issue, it helps with lots of other issues. Tachypnea is rapid respiration, so this is going to be above the rate of 24 breaths per minute. Bradypnea is slow respirations, so this is below the rate of 12. All right, a few more vocabulary words. So wheezing, this is difficult breathing with a high-pitched whistling caused by narrowing of the bronchioles. Now, at any time, if I'm going too fast, you can ask the substitute to pause it for just a second so that you can go back if you need to look at that other vocabulary. And then this video will also be posted on Schoology. So wheezing is when those bronchioles, so let's think back to our anatomy. We had the trachea, and then the bronchi, and then, or the bronchi, and then it split off into the two tubes of the bronchi, and then we got down to those smaller passages called bronchioles, and these are these itty bitty tiny passages because down at the bottom of them, remember, is that bunch of grapes that is called alveoli or alveoli, where the actual gas exchange takes place. So these very narrow bronchioles, if they get inflamed or if they get mucus in them, I'm breathing fine, but when I go to blow it out, it's constricted. So it makes this, and I had to force that out, but y'all have heard stuff like that before, like, so that's what they will sound like. And sometimes it'll be external. If they're seriously wheezing, they'll be external. You'll be able to hear it without a stethoscope. But sometimes if they just have, just a little bit of wheezing, then it's going to be, you can hear it with the stethoscope. And we'll do this next week with Nursing Ann. I'll make her wheeze and you guys can listen to it. But I just want you to think for just a minute. So let's say we put this patient on oxygen, okay? Well, they're breathing in fine, but they're not able to blow off. What are we supposed to blow off? We're supposed to blow off CO2. So they're not blowing off enough CO2 because it's being trapped in those tiny air passages. So they're going to end up with a higher level of CO2. It doesn't matter how much oxygen we give them. So we've got to fix the actual problem. Supplemental oxygen would be fine, but what they really need is a steroid, a fast-acting steroid like albuterol, to shrink those air passages. All right, cyanosis, I'm pretty sure we've talked about before. This is a dusky blue discoloration of the skin, lips, or nail beds as a result of decreased oxygen. So you never want your patient to be cyanotic. All right, so another interesting thing about respirations is we've got to count them in such a way that the patient is unaware of the procedure. You've had your respirations counted every time you've been to the doctor. You just didn't know that they were doing it. Respirations are partly under voluntary control, and so the patient